Oh shoot. Hey, Nurse Roxy.
What's up?
What's going on? What's going on? Good to talk to you again.
Likewise.
Yeah, pretty unfortunate situation that we have. Um, I sent you the article, and for my audience who just tuning in, welcome to the early morning broadcast. I'm here with Nurse Roxy. I caught her on an early morning, and the reason I actually sent Nurse Roxy this topic or whatever is because I know she feels strongly about substance abuse, drugs, alcohol, and unfortunately, we have a situation to where lives were taken. Um, it was a nurse out in California, and I'm going to get into the article. But before I get into that, let me ask Nurse Roxy, how have you been doing as of late? I know you got a lot of things going on right now. How you been doing?
Yes, so I'm doing good. Thank you for asking. I actually have a course that will be available and ready for purchase soon. So I'm doing all the behind the scene things just to make sure everything streamlines perfectly and the content is up to snuff, and also that uh, the students will be able to get the most out of the experience. So
Okay, so for those who may not be familiar, what is your course about, and can you let the people know your credentials and everything if this is their first time listening?
So I am a nurse educator. I'm also a certified risk adjustment coder. So I'm really more so on the business side of things. So I do lead a team of nurse analysts. And essentially, my goal is to help nurses to really actualize their fullest potential, understand the many different uh, options that are out there in nursing. I know that nursing as the profession and from the classroom side of things, I know that this is like a no-no because they don't really want nurses away from the bedside, because we're kind of like an army, you know what I mean? Like they build us up to work at the bedside. So when nurses stray away from the bedside, there's usually a lot of criticism coming from the nursing profession. But again, nursing is very dynamic. There's always opportunities to expand and advance in nursing. And I just want to make that a possibility for nurses. So my website is www.acd4n.com. Check out some of the content on the website. A lot of information has been added, more so recently since I started this course, because I really want to kind of get the wheels churning for some nurses who may not necessarily be familiar with medical coding and data analytics and how all of that is transforming the nursing profession. But thank you.
Or no problem. Let me also ask. So, Nurse Roxy, when did you decide to step away from the bedside? Like, how long were you in bedside nursing before you decided to step away?
So I was never quote unquote bedside, but I was working community based care doing case management, not
Okay.
home care, but case management.
Okay.
And I was actually doing that for up until 2000. So from that's 8 years. 8 years I've been doing that. And then working for an insurance company doing case management, it made me kind of really learn more and more about um, like managed care, how things get paid for, how to bill for services, and learning all of that really made me curious about the options that were truly out here for me as a nurse.
Right.
So one of the things that um, I had the pleasure of doing is meeting a nurse who happened to be a medical coder at this one insurance company I was working for. And I was doing field-based case management, but this nurse, like I really just pulled that nurse aside and just said, listen, I need to get about this field work. I can't be up in the field. I can't be up in people's homes. I wanted to do something different. So, the
Absolutely.
nurse said to me, Let me teach you about ICD-10 coding. Ever since then, that was back in 2019. It's been Hot Wheels ever since.
And so you've taken that information that she's giving you and you put your spin on it, and now that's what you're teaching other nurses, correct?
You got it. I'm combining ICD-10 with um, data analytics, which is a whole other area of nursing. The more familiar terminology is nursing informatics.
Mhm.
So it's kind of like bridging the two of those together. The professional medical coding aspect, because a lot of nurses are curious about what that looks like. But just a word of advice, it's great to have the certification, but you make so much more money, so many more opportunities when you are a nurse who's also certified. So I would never tell a nurse that they have to go out there and become certified to become a medical coder. I would say get the certification so you understand that area in that space, and so that you can build that bridge for yourself.
Now, is with that position being a coder, is that can you make six figures from that?
Multiple. First of all, you have the opportunity of always teaching nurses.
Hmm.
Most people who are even besides nurses, just professional medical coders, they wind up having some type of consultation or education service because there's such a high demand and there's so few people working in the industry. So like as far as a six figures piece, you can easily make that on your own. You could be a consultant where you work specifically for a group, provider group. You could also do the education piece, like so become an entrepreneur, teaching the information. Um, you could also become a content writer as far as like producing content for companies that uh, work in this space. So like there's always, because the thing about it is every place where medical services or every institution where medical services are being billed, there's always an opportunity for you as a person with that specialized knowledge to be a SME, a subject matter expert.
Hmm.
So, you could do that independently through your own services, or you could do that as being hired on, being that subject matter expert. So six figures easy because it is because you can scale it. No
Right.
one could put a cap on how much money you can make. In that it's like because it's not salary based. It's really about your salary on top of how much information you gain and can deliver because of the environment you're working in.
Wow, that's amazing. And that's definitely something that I'm looking forward to. And my final question when it comes towards this, because I'm all about working smarter and not necessarily harder. Is this a job that you can work from anywhere in the world?
That's the advantage.
Mm,
Almost 100% of people working in this area, especially if you're talking about data analytics, if you're talking about professional medical coding, they're working remotely.
cool. One of these days when you have a free day, we're gonna have to really do a show and put a spotlight on that particular profession because you're the only one that I've ever heard talk about nurse informatics and data analytics from a nursing perspective. And I'm sure they're out there, but I've never ran across anybody, especially in person, talk about that and be so knowledgeable. So definitely on a different day, very soon, I would love to do a broadcast on that because I do want to show nurses that there are other opportunities out there besides the bedside and all that kind of stuff. So I'm gonna have you back on very very soon so we can definitely break that down and show nurses that it's more options that they don't have to be burnt out by the bedside if they don't want to.
Thank, thank you. And who else but the high value nurse to have me on because you're about high value.
Absolutely, 100%. So, ladies and gentlemen, now y'all see the title, y'all see the headline. Unfortunately, tragedy has struck last night, and I'm gonna get right into it, boys and girls. But again, for those of you who don't know, my name is CJ Kyles, aka the High Value Nurse. I primarily talk about nursing on this channel. I am in transition to get my RN, and I start September 2nd. Well, no, first actually, and that's what I do. Now, let's get into the topic at hand. Now, last night, a driver was arrested in a deadly Windsor Hills crash. A 37-year-old woman that CHP officers suspected caused a wreck that will be booked after she's released from the hospital. Now, mind you, uh, the driver was she walked away, um, not really injured, none of that stuff. So what I'm gonna do is actually play. I'm gonna turn off this music. Hey Candidate, I'll put the link down here for you if you want to come on in too, because I know you're a nurse as well, and I would love to get your opinion on that. So there's the link right there if you definitely want to come up. Um, but let me see. Let me cut off this music and we can get into this really quickly. And it's so funny because I actually have a story about that once this is done about substance abuse among nurses, and not me personally, but I saw something in person myself. So uh let me see. Let me see. Let me see if I can.
New video shared with NBC4. And Chuck, that story is tough to listen to when you think about those families who are looking for justice in this. The first step, perhaps, to that is happening now. Early this morning, the woman involved in this was arrested, and she's facing some very serious charges. New video shared with NBC4 today of the aftermath of the crash at La Brea and Slauson that killed 6 people and injured 8. The flames still burning as emergency crews rushed on site. Today, we've learned most of the first responders are not at work, instead working with grief counselors over what they witnessed firsthand.
Just to see something like this happen, it's just tragic.
As dawn broke this morning, visitors to the intersection started to leave candles and flowers, offering condolences to families of those lost and hope for the injured.
Just can't stop thinking about them, and I thought to pay respect to all those families, including the driver. Because I have no doubt she didn't mean to do that, and she's gonna suffer from that the rest of her life.
The California Highway Patrol says 37-year-old Nicole Linton was the driver that caused the deadly chain reaction crash. We spoke on the phone with Linton's sister today. She tells us she's a traveling nurse, most recently from Houston, Texas, and that she was on her way home from work when the crash happened. CHP says because so many pain meds were given to the driver after the crash, there was no way to do a proper drug evaluation on site. But today, still being treated for her injuries, they arrested and charged Linton with vehicular manslaughter with gross negligence.
She came through very expedient. There was no brakes, there was no horn, nothing to indicate that there was something wrong.
The crash happened just before 2 yesterday afternoon. Among the dead, a young pregnant mother, her infant baby, and her fiance. And of those injured and hospitalized, all but one under the age of 16.
After this, I'm pretty sure everybody that comes to this intersection is going to be kind of nervous crossing this intersection now, including me.
And we did hear from the district attorney's office. They do call this a tragedy and say that they're going to be working with the investigators on this case through the weekend in the hopes of potentially filing official charges on Monday. Reporting live in Windsor Hills, I'm John Kiley-Mack, NBC4 News.
Okay. So that was hard to watch. That was very hard to watch. Nurse Roxy, can I get your initial thoughts when you saw that? That woman was going very, very fast. She had to.
When I say she was going so fast, I was thinking to myself, like, what could have been going through her mind? I mean, I see the video before, but before knowing the suspect was a nurse, a Black woman at that, I was surprised when I actually seen the footage shared, going on social media. So it just. Just imagine how frightened anybody was to actually witness that, because they're probably wondering what exactly, like what was that noise? In those situations, I've had like one close call I recall in my life. I was in like high school working at a bus stop, and these kids apparently stole a car and they ran into the bus stop sign that I was standing right next to. And I was so stunned that the people actually came off the bus, like the bus driver's like, "Are you okay, miss?" Because they just witnessed the whole thing. And that noise, that screeching sound, like of the cars making that noise, is just something that never leaves you. I can imagine this was like 15 times more than that. I can't imagine what the people who witnessed that, what they were experiencing and what they will continue to experience.
Yeah. And it was an unborn child that was also killed too.
and an infant. It sounds like they said an infant and an unborn child.
The infant, they said the infant flew out of the windshield and landed in front of a woman, and she picked up the infant, but the infant was gone by the time the responders got there. Just a horrific thing. And I was reading the article, and then I went on to a nursing group. I'm not gonna say the name of the group, but it was a nursing group. It's a pretty popular nursing group, and they were actually talking about it. And they were saying that, only God can judge, and we shouldn't judge. We don't know what's going on with this woman and everything like that. And I understand that concept, and I do understand that point of view. But if this was my family member, I would not give a F about what that
Imagina lo que
person was
tus hijos
going through
pueden lograr con una
because
educación pública de alta calidad, flexible y personalizada.
sorry about that, y'all. I would not give a F about what that person was going through because a baby was lost, an unborn child was lost, and you decided to get behind the wheel intoxicated. That's a problem. That's a problem. And the rise of substance abuse among nurses, I actually looked up an article, is definitely rising. Um, what do you think about this? Do you think being a bedside nurse is more um they're increasing the chances of nurses turning to substances to numb some of the pain and some of the things that they see out there?
You can't see. To me, I feel like nursing is one of those industries. I mean, think about what's going on now, even with the monkeypox. I hate to switch off like that,
Right.
but just to know that you have to go to the bedside and look at someone in that condition, care for someone in that condition, and you're in a profession that tells you everything's okay. You'll be all right. You'll be all right. All the news is telling you, oh, scary. They're telling you you're gonna be okay. You're on the front line. So again, it's just like people in the service. How sometimes people in the service, they see so much, they kind of just get, like, I guess they call it shell shock. I think
Hmm.
you just kind of, and that PTSD. I think nurses definitely are at risk for suffering that because of the nature of the profession.
Mm. And it's crazy too. It's a lot of, she was working at Kaiser Permanente. That hospital has been associated with a lot of bad things. Like nurses deleting themselves at the hospital. Just a lot of bad things. I don't know why. I mean, it could be just coincidence, but it's it's a terrible thing. It's a terrible thing. And I was gonna mention on the broadcast that I was working and the nurse had stole several medications, several narcotics and everything like that. And it was so crazy because this particular nurse was an agency nurse. She was not a staff nurse. She was an agency nurse, and she was taking a very very long time to complete the med pass, longer than normal for any med pass, like hours, like 4 or 5 hours. And then she was taking a cart. I don't know if maybe some of y'all are not familiar with how long-term care nursing carts work, but it's a wheelable cart where you have all your medications placed in these different drawers and everything like that. Your computer sits on top of the cart. And with that being said, she will wheel the cart into each individual's room, which is not normal. Now you do have cases where that happens. There are some places to where the medications are locked inside of the patient's room, so you will have a smaller computer on wheels, and you will take it in. But that's not normally how that works, and it wasn't how it worked in this particular situation. So she was taking it in the room, and then all the patients that were in their right mind were complaining about not receiving their medications, not receiving their narcotics. And when you work in long-term care, you know that these patients, some of them are very much so on their narcotics when they get their pain pill. Some get a Q4H, some get a Q6, and they are very much aware of what's going on. So, with that being said, these people were complaining. People who were A&O times four, who are alert and oriented, they know when they get their medication. So, that she was signing the medications out, but they were not being accounted for. So to make a long story short, it turned into this whole debacle. The DON had to end up coming in. They wanted to drug test her. They left her in the building. Well, she tried to leave, but she didn't know the code to get out. And I guess nobody was going to give her the code because the DON wanted to come up and drug test her. And she locked herself in the bathroom. And apparently, all the medications that were missing, she just happened to have, from what I've heard, a prescription for every single one of those medications that went missing. That's what I heard. That's what she told the DON. So have you heard of stories like that, Nurse Roxy?
Yes. Unfortunately, I think what happens is you have human beings. I mean, the thing about it, these are people's personalities and the way they cope. And then they happen to be in a profession, at least I look at it this way. They happen to be in a profession where they have access to medications and, substances that can help them cope with their their issues. Because I think that don't get me wrong, I believe that the profession can bring some of that out, but I also believe you have people who may, it's that whole nature nurture thing. What I mean? It could be their personality and their environment that they can have access to substances. It could be, a combination. I don't think it's a one without the other thing. It could be just both, you know.
Mm.
But I've heard of those sort of situations definitely where the patients, and that's usually where you get it from. Either maybe the nurse doing that reconciliation count at the end of the shift, picking up, hey, listen, Bobby Sue said they didn't get their pain medication, but it's been signed out every night on your shift. What's up? You know what I mean? Or like the patient saying, look, I'm in pain. And then you look and you find, my sister, in fact, worked at this hospital. She found a provider literally in the bathroom. Patient medication was not administered. Patient said that they were in excruciating pain. And then the provider was in the bathroom. They found a provider in the bathroom with the patch on. I think if I'm not mistaken, I think it was like a Demerol patch, something like that. But he was just that's just the kind of thing some people are into. Some people, I even heard of course, I mean, you can do with any kind of type of medication, whether it's they're going to inject it or oral. I could have been mistaken about the patch. It could have been something that he injected. But at the end of the day, the provider was found in the bathroom.
Wow.
With that medication on him.
That's crazy. And it could be a number of things that could lead to a nurse doing this. What if, I don't know, like if you were in charge of a particular facility or something like that, what actions would you put in place to try to lessen the chances of something like that happening? I think a lot of nurses need to seek therapy. I think therapy should be absolutely mandatory, and I think it should be a part of the continuing education requirements, actually, to go seek therapy, because it is unnatural for a person to come in contact with death and to see people in pain and all that kind of stuff on a normal basis like that. That's something that some nurses see every single day, and for that to just go untreated, untreated and unseen by a professional, I think it can definitely lead to somebody doing that on top of what may go on in someone's personal life. What do you think about that? Do you think therapy should be mandatory, especially for bedside nurses?
Definitely. I think, again, like I said about the brainwashing, I'm realizing it more and more, when I hear when I hear, learn about the things that nurses are expected to do, and people just pat you on the back and say, as a part of the profession, I would hope that the kind of attention that, service men and women get related to, PTSD and, just dealing with what they're exposed to, I would hope that kind of sensitivity could be more extended. I know there are programs in place already, but, more attention brought to that, because, nurses are asked to do a lot, and a lot gets chalked up to, well, it's your job, you signed up for it, or they pay you enough, so you should be able to do it, you should be able to deal with it. So, I think there should be processes in place to almost foresee things too. You know what I mean? If you put a person in a situation where it's a lot, it's a tall ask, be able to acknowledge that it was a tall ask as a manager, you know what I mean, from the executive line, and say, let's have these things in place because we know we're asking to do a lot right now. So just have it in place. Don't even have it to where the nurse has to come ask for it, because the nurse may not have the wherewithal. The nurse may not feel comfortable enough to say, I am stressed out in this area. Because some people may look at it as if they come and actually express that they have an issue, it's looked at as oh, you're not a professional or you're not a competent nurse. So the system should be in place with an expectation, maybe even having feedback or survey forms available so that there is an open space where nurses can actually communicate this, and they don't have to, they can, remain anonymous if they even want to.
Right. Right. Yeah. Um, I, I think it's actually becoming quite a joke at this point because, like I said, on top of all those things that nurses see, and on top of what may be going on in a personal life, don't even get started on the pay. And that's why I said, though, that's why I always preach that this is a business, and you have to understand that going in. That is why it's your job to navigate as such. Like how you got in the game, you doing your nursing informatics, you have your own classes, you are an entrepreneur, you are a nurse educator, you got in the game, saw it for what it was, you got in, got out, and you flipped it to your advantage and to your benefit. That's why I believe, me personally, I want to go to the ICU and I want to go ahead and work in the ED so I can become a highly trained, highly experienced nurse so I can flip that into some sort of educational opportunity where I don't have to be at the bedside for 20, 30 years. Like I said, 5 years max. I mean that. You know what I'm saying? God willing, I'm trying to do 5 years so I can see what I need to see, get in and get out, because I see a lot of nurses, especially in long term care, and this is just long term care where patients are stable, where they're supposed to be stable, where the acuity is not supposed to be as high as somebody who's in a ICU environment, and these people are absolutely miserable. Now, again, you don't have to be that. You don't have to be miserable. Sometimes you put yourself in a situation to where you are. But again, this is why I said you have the beauty of options. Of course, you have to start somewhere, but this will always continue to happen if you don't take proper self-care. And let me see what my man Peter got to say. What's up, Peter? Peter, you here? All
He's
right, man.
still muted, so hopefully
Peter,
he can
Peter, you
unmute.
yeah, you muted, Pete.
Oh, hey, good morning. Good morning, guys. How are you?
What's up? What's going on with you, sir?
Yeah, I just wanted to chime in briefly because interestingly, I just signed up to be a part of there's something called the Peer Assistant Program, and it's designed for nurses that have issues with substance abuse, alcohol, and I put a link in the private chat here, so if you have time to look at it,
For
and
sure.
you have a lot of people, but because you kept talking about the ICU, and what we find out is that there are two key areas of nursing that I kind of exposed to that kind of abuse: the ER and the ICU. And if you've ever worked in that setting, they're very notorious for not scanning anything. I mean, due to the nature of the way the floor is for the most times. And anybody that works in a hospital knows each time an ICU person sends you a patient upstairs, nothing is scanned because it's the turnover is very high sometimes for the ER. So people that are prone to abusing drugs as nurses tend to work in those areas where they have access to those kind of drugs. And there was time I worked in ICU in a trauma hospital. We found a nurse that actually died. We found him dead in the bathroom of an empty room, and he
Wow.
had a fentanyl patch in his mouth. He was chewing fentanyl patches.
Wow.
So it's just that sometimes there are areas that you have access to those kind of meds, and for a solution, I think it depends on, they have to change. I think they call it the three-step system now, where you put in three letters, you have to scan everything. But, in practicality, in reality, it's not really, when you work in a very high-paced environment, sometimes, you have, people don't have time for a lot of things, and they care more about saving lives in real time, and, all those kind of things. So that kind of factors it as well. But I just joined the peer program because, somebody encouraged me to, I had a friend that actually died. Um, was an alcoholic as a nurse for years, but it was not because it was in the hospital. It was for a different. He went into depression, died, and I came through this program and I said you can actually help people that are nurses and are going through that as well before they get into cascading into depression and suicide and other kind of things. So I joined that to be a peer reviewed and to help other people, you know. So I just had to put that in there for to help whoever is listening. Maybe that can help someone out there.
For sure. Let me ask you, Pete, and for the people who don't know, you are a nurse practitioner, correct?
Yeah, I passed a few months ago. Yeah.
Well, congratulations to nurse practitioner Peter. That's a very great look. And let me ask you something in your personal opinion, just like I asked Nurse Roxy. Do you feel that it should be mandatory for nurses, especially that work in the bedside, to have mandatory therapy?
Oh, we all need therapy from time to time. You
Mhm.
know, because they project nurses as some kind of Superman or Superwoman. Like our lifestyle. I mean, if you work nighttime, for instance, right? If you work 12-hour shift or 8 hours or double shift, you always have a full bladder. You get the insults from disrespect from administration, from family members, from patients. Those kind of things accumulate in your head over time. There's so much you can take. So there has to be some kind of therapy sessions offered by the hospitals or even breaks where you take mental breaks, maybe a week off from work and you still get paid for it, just to relax, just to take your mind off, like some time off away from your PTO, something just to help you. So I do agree with that we as nurses need that, and but unfortunately, high value nurse, this is the reality. Having said that, hospitals are not treated as hotels. That's the way they market it to people. So when the people come in, they think that they can order steak at 2 o'clock in the morning. They can boss you around, tell you what to do, and they have this thing about they are always right. If you have any issues with a patient and it gets to management, you know how that goes. The first thing is they were right, you're wrong. What did you do?
Yeah.
So it's mentally taxing on the nurses over a period of time. But I do agree that there has to be some kind of therapy for people, especially during the pandemic. A lot of people went through a lot of things, as nurses. But money just trumps but nurses health sometimes. That's just the reality of it.
Yeah. It's business.
Yeah, it's business, sadly, man.
So what was the reason you got it to be a nurse practitioner? Did you want to get away from the bedside and work more towards more closely with the doctor more, like and what's your ultimate goal as far as your career as a nurse is concerned?
Yeah, I worked in the I was a CNA actually, so I kind of worked my way up a little bit. So I worked with this group of doctors in this local county hospitals. And those local county hospitals, you know how some doctors, when you've worked with them for a while, they start to trust you with orders that you can even put in without asking them because they know what they want for that particular disease process.
Right.
So the more they trusted me with putting in orders for them, it kind of saved them the stress of people calling them every 5 minutes. So it then became like, even before anybody called the doctor at 2 o'clock in the morning, say, okay, run with Peter first. Should I call this doctor? And I'll say, don't call him. This is what he usually orders for this and that. So one of the days, he said, what, you're pretty good at this stuff. Maybe you should, try to, make it official. Just go to school, and when you finish, we'll take you. So that's how that came by. So it was years of experience in that and loving to that transition to have more autonomy.
Right.
Yeah,
How long were you on the bedside?
12 years.
12 years. So
12
you
years.
really got to know the profession in and out. So
Right. 12
absolutely.
years.
Well, that's a great thing, man. And like I said, I enjoy stories like this where, people, especially people of color, can come together and show that you can be successful in different branches. Nurse Roxy, she does nurse informatics. You yourself, you're a nurse practitioner. Me, I'm transitioning to get my RN, starting my my career in ICU and
Hey,
ED.
you get that, man, and I agree with you. We need more people call black people in healthcare, and Roxy can testify to that. How that impacts, especially black women, when it comes to critical issues. Trust me, a lot of black women, suffer a lot of that. So we need more black people to, as that just shows that when you have your own people that look like you, taking care of you, you get better care and better outcomes. It's just facts. So I think Roxy can testify to that as well. So we need more black people in healthcare to help out other people.
What do you think about that, Nurse Roxy? About what Nurse Peter just said?
Well, I just want to first commend Peter for his accomplishments. First, you said you completed your nurse practitioner program starting as a CNA, so shout out to you for that. And also,
Thank you.
also becoming, that peer, that assistance program, that support for nurses. I think that's important that you actually found that even if it wasn't directly happening to you and in your body, you seeing the impact of substance abuse in another nurse and you and depression, and you felt that that was a good enough calling for you. So that's good. I commend you for that. Now, again, there is definitely a lack. I mean, personally, I'm in a management role at a major insurance company, and interestingly enough, oftentimes when we're on our, big regional calls, and they call them the big wig, the big boys. I look around and just a few of us. It's just a few of us. It's just a few of us. And unfortunately, that pressure is always on you to represent. So, you coming with your best, I'm coming here before everybody. I'm logged in. I'm guns blazing, ready to do my reports, got my analytics tight, want to show my stuff, show that I know what I'm talking about. So, it's great role modeling. Of course, the nurses that I actually manage a team of nurse analysts. So they definitely, appreciate that they can come to me, especially the nurses of color. But definitely we need to have more. And it's interesting, just a little side note, CJ, no, I always go on my little tangents, but this is a little side note. I was reading an article today about CMS, like their expansion into like rural areas. And of course, we know that's always been an issue in healthcare. Like, how do you really, expand access to care and ensure quality care in rural areas? And one of the things that stood out was that, in this particular area they were looking at, and I apologize that I don't have the actual city and state in mind, but this particular area they were looking at, they were saying that, Black people are still, even in that situation where you're just thinking rural, you're like, okay, well, all of these people are suffering, right? When you think of rural, you just want to think that everybody doesn't have quality care. It's still premature death much higher in amongst the Black population and compared to white. Just the typical things that you kind of raises your eyebrow a bit, because you think to yourself, well, how is it that Black people are suffering so much different, so different from these white folks who arguably are in the same situation, because both of them don't have access to quality care, but still that Black person suffers more. And the only thing I could actually think about, just reading the article was, it got to be the fact that when they're getting care provided for them, they're just not getting the same quality care. It's obvious. So yeah, we definitely need more of us to ensure that we have healthy Black communities for the future.
Yeah, Roxy, beautiful you said that, because interestingly, I am actually following my mentor that I did my clinicals with. We're going to the Capitol because she's one of the MPs that got picked to come speak in front of the House because we still have some restrictions for MPs in Texas largely. So they're fighting to have full autonomy so they can get paid more and expand access to those areas you talked about. And I'm going to be following her because as she delivers an argument in front of the Senate in Austin, Texas, to expand the care into those rural areas. And I think that will help Black people as well. So we can have our own people provide those assistance. So I'll be there. You might see me on TV somewhere.
That'll be dope. When is that happening?
Yeah, sure.
That is September 2nd.
September 2nd. All right. Well, Pete, please shoot me an email and let me know how it goes, and we can have a conversation about it.
Yeah, let me double check it. I'll let you know. Let me double check it.
I'm gonna put my email in a private chat. But but that's dope. And Nurse Roxy, on a side note, you work for insurance companies and everything like that. Now I don't know how much experience you have working in long. Well, you probably don't have any experience in long term care insurance billing, do you?
Long-term care insurance billing. I would say some.
Okay. Well, as people know, I had brought up an article a while ago, and I talked about how it was cheaper to live in a five-star resort or on a cruise ship than it is to retire in a nursing home. The average cost of a nursing home per year is 100 grand.
What?
One
Really?
hundred grand. Yeah, absolutely.
That is everything, right? The
Everything.
meds.
That's on average.
Wow.
That is on average. So Uh, as far as the billing aspect, Nurse Roxy, what do you think about that? Does that shock you? Does that surprise you?
No, not necessarily. And the interesting thing about it is, there's been such a push to have that patient-centered home or that medical home or what they call aging in place, where you have people pretty much getting care in their homes and being more connected to community-based services. So no, that doesn't surprise me because I definitely see how the healthcare industry has responded to that cost. I mean, I can see where I can understand stand it in the grand scheme, especially because of that agent in place movement.
Mm. And this is why, like, in the future, like in the near future, like health is really going to start being like a big part of this channel. Because, like I said, I've been really going to the gym consistently. I've lost like 15 more pounds, and I feel absolutely great. And it is in, it is in their best interest that people get sick because that benefits. And I don't want to end up in these nursing homes. I don't want to, like, being in these nursing homes personally and seeing these people personally having their legs, having their arms cut off, having to have a peg tube, having to go to dialysis every single, not every day, but like 3 days a week and everything like that. But that is a difficult thing to deal with. And I feel like seeing that every day, that would at least motivate more people to take that serious that are in that field. But like working in long-term care as an LPN, I see the most out of shape, unhealthy people that I've ever seen in my life.
That's
You know what
good.
I'm saying?
Well, how has the acuity level been with you working in long term over the years? Has it increased or has it stabilized?
It's definitely increased because um a lot of places are starting to take on more patients that require a higher acuity of care. So, and it's saving the money, and them on with them not having a staffing, it puts more on a nurse, it puts more on a CNA and everything like that. Like I went into this one facility where I had like 7 peg tubes, I had 3 trach patients, and people just needing meds, and I had a couple psych patients and everything like that. And it was a lot, but it
trach
was I'm sorry.
in the nurse? You said trach in the nursing home, man. Man, trach in the nursing home. Trach
Yeah,
is like wow,
no respiratory therapist. It was all on you. And
wow.
I actually enjoy that part of nursing. I do enjoy trach. I like doing performing trach care. I don't know. I have this weird like little thing with how that whole process works. So I didn't mind that, but that is a lot for one person, and you're short staff, and you got 30 patients, and you only got 2 CNAs. Like it's a lot. You know what I'm saying? You got people who are highly addicted to drugs, and a lot of people are coming off the streets homeless. It is a lot going on in long-term care, and the culture of long-term care as a whole is absolutely garbage to me. Um, it's not something that I want to stay in a long time, but I do understand as an LPN that is where the bag is for the most part. And that's fine. And I can accept that. And not all places are like that, but for the most part. And it even really isn't the patient so much more, but it's more so the coworkers because the morale is so low in a lot of these places. Um, it's irritating almost to deal with, but that's part of the game. So, but ladies and gentlemen, I think I'm going to get up out of here. If any of you all want to say any final words, please feel free.
Roxy, you want to go first? Go ahead.
Sure. I want to commend Brother CJ. You know, health is wealth. Thank you for leading the charge on that. You definitely do motivate me. I know I haven't been on the show in a while, but I definitely been following you, and I'm so proud of the progress that you've been making, just in general as a nurse, professionally and personally, health wise. And also, congratulations to the Queen. I see that she's stepping up and she's doing her thing too. So, you know, 'cause she recently graduated. So, you know,
Yeah, shout
congratulations
out
to
to
her
her.
as
Shout
well.
out to her.
Yes. So I just want folks to know that, you know, especially in the nursing world, if you're feeling overwhelmed and you're feeling like you know, you're turning to substances for whatever reason, you know, just really take time to consider you're in a profession that can wear you down. You
Hmm.
have to have a real plan in place to deal with your personal care and needing personal time. And, you know, self care is something that you have to prioritize in nursing. I know we got all the flash and the Louis Vuitton bags and the Benzes and all that stuff. And sometimes that distracts us from what we actually have to go through to obtain those things.
Yep.
So we just have to just be conscientious about taking care of ourselves, because we can't really be beneficial to others if we are not taking care of ourselves. And we will break down just like anything else. But please also visit my website, www.acd4n.com. Again, focused on helping nurses transition from the bedside, but also to gain real skills in a tech savvy nursing skills in a world where in healthcare we are continually including technology in what we do. So we definitely want to see you visit the website, check out some of our content, watch some of our videos just to kind of get an idea of what we're all about. Thank you.
Yeah, y'all definitely go check out Nurse Roxy's website. It's very fly. It's not no brown paper bag production website. I'm on it right now actually, and it's a very eye pleasing website.
Can
So
you
she's
post can you post the link to the
I'm about to post it right now. Um, and I was just looking at it actually. It's a very fly website. Yeah, this is not no brown paper bag production. So I appreciate that. Y'all go check out Nurse Roxy if you want an alternative to the bedside. She's giving you the game. Um, and this is what I preach, ladies and gentlemen. Uh, if you want to do better for yourself, you have to go out there and put in the work and make yourself better, make yourself valuable. And just like she said, you have to be 100% intentional. You have to have a plan, because this job can break you down, your body down, your mind down. It is not, to me, it's not a older person's game. It's really not. And I feel like with getting older, you have to be wiser. You know what I'm saying? With how you use your body and your resources, and with the way you give it to nursing. But let me pass it to nurse practitioner Peter.
All right, just to thank you for having me, CJ. I'm really happy that you're stepping up into becoming RN, and I'm really happy that you said you love tricks. You would really love the ICU, and they would love you too over there. So you are in you're in the right direction. Okay, so looking forward
Appreciate
to working with you. And but just to piggyback to what Roxy said, for any nurses that are listening to me right now, don't let your coworkers or your bosses at work guilt trip you into working overtime, or thinking that because you don't work an extra shift, or you don't pick up, or you don't stay late, that you're a bad person. Take all your PTOs, take the time off. If you can self schedule. Because I know in nursing, for some reason, if I take time off, I'm seen as being lazy. You know what I'm talking about? Like, you don't work overtime, you don't stay late, you just come do your thing. So that helps mentally as well. So just come do your thing, care about yourself first. Take care of yourself. Take time off. Go to the gym, work out, whatever you got to do. Just take care of yourself first. Don't try to be a superhero sometimes. Because when you die, I lost three nurses. One of them actually died in front of me during the shift change.
Wow.
But that's a different story for another day. Because we used to work like 14 days straight, 15 days straight back in when I was, still trying to chase that bag,
Right.
crazy chase. But at the end of the day, when she died, within a week, they got a new person and they just moved on.
Yeah.
So no matter how important you think you are as a nurse to that department, when something happens to you, they're gonna move on.
That's a fact.
So yeah,
That is a fact. Nurses, please listen. Y'all know me. Y'all know I promote going on vacation every 30 days.
take it, man.
Every 30 days. You are in a profession where you can self-schedule. Y'all better take that vacation. Y'all better go on a nice cruise. Y'all better go on a nice all-inclusive resort. You can afford it. You can afford it. Go ahead, take your little trick money and go ahead and treat yourself every 30 days. I don't even care if you stay home. Even if you're staying home and you go get you a nice massage and you go around, drive around your city. Go take your vacation every 30 days. It is absolutely no reason why you cannot and why you should not. It
Yeah,
should be in the
yeah.
contracts, actually.
Don't
Real
don't
talk.
never feel bad for taking time off. Never feel, because I know how nursing is. You know, they make you feel bad for not picking up extra shift and not doing. You know what I'm talking about. You can walk your 10 days straight or whatever, 5 days straight, and take your 5 days off just to cool off. Yeah,
Yeah.
do all
Yeah.
that.
You ain't gonna make me feel bad.
But you know what you know what I'm talking about, right?
No, I
You know
know.
what I
Yeah.
mean. Yeah.
Oh yeah. Even in long-term care nurse, people try to be like, "Oh, you going again? Oh, we really sure? Sorry, I'm off. There's nothing I can do. It's nothing I can do. I'm off. I'm about to go. I'll see you when I get back. I'm about to go get this tan. I'm about to go chill and eat some food I can't pronounce and sip on some very good drink. And I'll be back. I'll see you when I see you." So, but yeah, ladies and gentlemen, once again, please hit that like, subscribe, notification bell so you don't miss any of the content. My name is CJ. I really appreciate Nurse Roxy and Nurse Pete for coming on and giving y'all the ism with me. So once again, thank you to you all. And until next time, if you don't do nothing else, nurses, please get paid. Young nurse, get paid. And I bid you adieu. Peace.